Hi, it's Karen Damshan with Damshan Financial Planning. And today I'm just going to have a quick chat with you about different types of care that you might receive outside of your primary care physician's office, specifically if you had more of an urgent need. So I want to talk to you a little bit about what the difference is between using something like telehealth or telemedicine, or even going to one of those walk-in clinics versus going to an urgent care versus going to an emergency room, because your insurance company views those as very different types of providers, and sometimes very different bills come depending on where you choose to seek care. So generally, we would think that a walk-in clinic or telemedicine, we would use it for mild to moderate illness. You're okay seeing a nurse practitioner. Maybe you woke up and you think you have pink eye, or you have a sore throat, or a little cough, or something like that. You might need prescriptions, and they can typically write those prescriptions for you. And you may even be able to have them filled on site at one of those walk-in clinics. But telemedicine doctors can usually prescribe as well. So pretty easy. Maybe you can do it just from the comfort of your own home if you use telemedicine, or right around the corner at one of those walk-in clinics. An urgent care center is for things that are considered a little more moderate to serious, or an injury that maybe isn't life-threatening. So care is often with a doctor, although we do tend to see physician's assistants or nurse practitioners in urgent care facilities as well. But they are typically well um, positioned to treat things like maybe a sprain or a strain. If you're throwing up, or you've got a fever, or maybe a cut that needs stitches. I know I had to take my kiddo not too long ago for some stitches. And they, of course, can prescribe. Sometimes they can fill meds on site. And oftentimes they will have x-rays and or lab technicians in those urgent care centers when you need those. And then kind of the third type of care I wanted to cover is, when should you go to the emergency room? So we should use the emergency room for things that are actually emergencies. Now, I don't know if you've been to an ER lately, but the waits are so long. So I know none of us want to spend any more time there than we absolutely have to. So we typically think of emergency rooms for life-threatening or very severe injuries. Care is typically with a team of medical professionals. And of course, you can usually go to an emergency room 24/7. So some things that you might consider taking to the emergency room rather than an urgent care would be things like chest pain, an injury to your head, a serious burn or a serious cut. If you have weakness, or you on one side of your body, or you've lost the ability to speak, those are all reasons why you would definitely want to go to an emergency room. Pain that can't be managed easily. An urgent care or a telemedicine doctor isn't really going to be able to deal with any of those significant issues. Um, and of course, you can get prescriptions at an emergency room. They have all the fancy equipment to do an MRI or a CAT scan or whatever you may need. So the emergency room is definitely for when you need kind of an extended level of care as well. I do know from my own experience that oftentimes if you have like an injury or something going on with your eyes, you can't necessarily just see a doctor at an urgent care center. So it also never hurts for you to call ahead to an urgent care center or an emergency room. Let them know you're coming, let them know what's going on. That way, if you need to be in an ER instead of an urgent care, that urgent care center can tell you, so you get your care as quickly as possible at the right facility. Of course, as always, if you have any questions, I'm always here to help. Feel free to reach out anytime. I'll be back in your inbox again next week.